We're good to go?
Here.
All righty. Well, good morning. Today is Tuesday, June 22nd, 2021, and this is a regular meeting of the Kings County Board of Supervisors. Due to issues arising from COVID-19, the board is using a teleconferencing format for today's meeting, and we are participating via the World Wide Web. If you'd like to make a public comment today, please make sure you are identified by name in the Webex system. For those interested in commenting during unscheduled appearances, please use the raise your hand feature and wait to be recognized. Each speaker will be allowed up to 2 minutes for public comment. Each vote will be a verbal or voice vote so that members of the public can hear how each board member has voted. After we have had a motion and a second regarding each item we take up today, we'll be doing a roll call vote by district. Madam Clerk, would you please call the roll?
Joe Neves.
Here.
Richard Valley. Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
Here.
Okay, we have 5 present. So we'll move forward with the meeting. At this time, we'll call on Pastor Andrew Cromwell from Quanian Church for the invocation. Good morning.
Morning, all. If you would just bow your heads and we'll pray together this morning. God in heaven, we thank you so much for your goodness and your grace that you have said to us that we can come to you at all times. And we do that right now. We come to you and we ask for your blessing, your wisdom and your grace on these proceedings, these meetings that are happening. Lord, we thank you for the way that you have carried us through and continue to carry us through challenging moments in our world. And I'm asking for continued strength and wisdom that you would give those to the board, to the staff of the county, each department head, each staff member. Lord, these are challenging times, but we know that you have given us and you have given us your grace and you've promised to be with us always. So today, Lord, we just invoke your name, asking for your wisdom, acknowledging that on our own, we can do very little, but with you, Lord, we can do great things. And so I'm asking for all of those who are heavy today, who are carrying great weight of responsibility, great weight. I just pray that you would today give them strength to keep going and to do so, Lord, in your might. We pray this in your name. Amen.
Thank you very much. Okay, would you please join me in the flag salute? Ready, salute. I pledge allegiance to the flag to the republic which stands one nation under God, indivisible, for all. All right. With that, we'll move to item 2, which is unscheduled appearances. Any person may directly address the board at this time on any items on the agenda or other items of interest to the public that is within the subject matter jurisdiction of the board. 2 minutes are allowed for each item. Clerk?
I do not have anyone with their hand raised, and I do not have any written correspondence.
Okay, very good. Thank you. At this point, then, we will move to item 3, which is approval of the minutes of the June 15th, 2021 regular meeting. So board, what's your pleasure?
Move with presented.
Okay, we have a motion by Verboon, second by Fagundes. Madam Clerk, please call the roll.
Joe Neves.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor, motion carries. We'll now move to the consent calendar. And board members, you have the consent calendar before you. What's your pleasure?
I'll move with presented. Neves will second.
Okay, we have a motion by Verboon, second by Neves. Madam Clerk, please call the roll.
Joe Neves.
Yes.
Richard Valley.
Aye.
Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor. Consent calendar is passed, and we'll move now to item 5, which is regular agenda items, and 5A is Department of Finance. And who do we have? Rob.
Good morning, Mr. Chairman, members of the board. Rob Knutson with the Department of Finance. As you may recall, 2 weeks ago, I presented the introduction of an ordinance establishing our jail booking fee rate for the 21-22 fiscal year. As a quick recap, the proposed calculated fee is $135 per booking, which is a $4 increase from last year's rate. The increase is mainly due to employee benefit cost increases. So again, basically, we're just setting this rate in case it can be used in the future. Current legislation does not allow us to apply this fee to anything right now. So with that, I ask you consider adopting this ordinance establishing our jail booking fee rate for fiscal year 2021, 2022, and waive the reading. Thank you.
Mr. Chair, if I could just clarify for the record, the board cannot adopt the ordinance today. It can waive first reading, but there will need to be a second reading and a public hearing.
Very good, thank you. With that, board, what's your pleasure?
Neves moves to accept the recommendation.
Second.
Okay, we have a motion and second. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley.
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Okay, we have 5 in favor. Motion carries. All right, thank you, Rob.
Thank you.
Appreciate it. Okay, at this time, we'll move to item 5B, which is Public Works. And Dominic, welcome.
Good morning, Mr. Chairman, members of the board, Dominic Tyberski, Public Works. Can you hear me okay?
Yes, sir.
Very good, thank you. So I am before your board this morning to request adoption of the resolution approving the improvements to be constructed by the California High-Speed Rail Authority and authorize the chairman to sign the title sheet of each plan set. Approval will be limited to those improvements constructed within the existing or future Kings County right-of-way and limited to those improvements which will be the maintenance responsibility of the county per the executed settlement agreement. Prior to the settlement agreement between the California High-Speed Rail Authority and Kings County, the authority was acting on behalf of the county, and as such, many of the plan sets were approved without county input. As a direct result of the settlement, the authority agreed to revisit the approved plans, providing the county an opportunity to propose mutually acceptable design changes. This process has been ongoing for the last 18 months or so, which has included bi-weekly meetings between the authority, the county, and our consultants, QK and ZHA, who were hired to provide plan review assistance on behalf of Kings County. This resolution is a culmination of our collective efforts, which has resulted in a consensus regarding plan approval. As such, Public Works recommends adoption of this resolution, which will enable the chairman to complete the approval process. And I'd be happy to answer any questions you might have.
Very good. Thank you, Dominic. Questions from the board?
No question to move for approval. Second.
Okay, we have a motion by Fagundes, second by Verboon. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley.
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
We have 5 in favor. Motion carries. Thank you, Dominic.
Thank you. Thank you.
All righty, we'll move now to item 5C, which is administration.
Good morning, board members. Kyria Martinez, Assistant County Administrative Officer. Pursuant to Chapter 2, Article 2, Section 231 of the Kings County Code of Ordinance, a recommendation is being made for a qualified applicant for the position of Director of Community Development. It is recommended that your board appoint Mr. Charles Kinney effective June 28th, 2021 to the position. Mr. Kinney has a Bachelor's of Arts degree in geography from the University of California, Santa Barbara, and has served in the county's community development agency since 1999. He's been a deputy director of planning since 2010. Mr. Kinney has over 21 years of public sector experience in community development. The position is recommended to start at $12,600 per month, and the salary and benefits costs will be included in the final budget 21-22. At this time, the recommendation is to confirm an appointment of Charles Kinney to the position of Director of Community Development effective June 28th, 2021, and set the compensation.
Very good. Thank you for that. Madam Council, do you have any further additions to that?
I do not. Thank you.
All right.
I'll make a motion to support Charles Kinney as the new community development director.
Neves second.
Okay, we have a motion by Verboon, second by Neves. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley.
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor, motion carries, and big welcome to Chuck Kinney, and look forward to your leadership in that position and on into the future.
And we get to call him Charlie or Chuck or Charles, whatever we want now, huh?
You go ahead and do that.
Some limits to that.
All righty. All right, we'll move now to item 5D, which is public health, and our public health director, Mr. Ed Hood.
Good morning, Mr. Chairman, members of the board. Ed Hill, Public Health. I'm going to go ahead and start my report as I do always by reminding everyone the simple steps we can take to protect ourselves from communicable diseases. Those are frequently wash your hands for 20 seconds or more. Don't touch your face with unwashed hands. Stay hydrated with water. A hydrated cell is a healthy cell. Stay home if you're sick, and wear face coverings where required. My update is going to be brief again this morning. Our daily numbers are available on our website. We do continue to watch hospital data closely, and we continue to see a small decrease in hospitalizations, admissions in med-surg, and admissions in ICU regionally. Last week, I did report a small increase in both med-surg, general admissions, and ICU locally, and it appears that the med-surg or general admissions have leveled off, but the ICU admissions have continued to increase slightly. I also wanted to make sure I clarify that the cases we are seeing are nowhere near to what we saw during the last outbreak. And as of 6/20/2021, the local hospital had 6 patients in med-surg and 3 patients in the intensive care unit or ICU. After further investigation, we have learned a good proportion of them are old cases, meaning that they have had the virus before, recovered, and have been admitted for something else, but they are still being tested as precautions and showing positive. Additionally, we learned that a large proportion of them are not Kings County residents and are instead from other counties. Our PPE status has not changed. We still are maintaining that 60-day supply of PPE. The mobile testing site program schedule is on our website. As a reminder, we have made some modifications and now are also offering testing at all of our clinics, and members of the public can get tested at these clinics for a more climate-controlled environment. As mentioned at our last board meeting, the Blueprint for a Safer Economy has been retired, and there is no longer any restrictions on physical distancing and capacity limits except for mega events. Additionally, Cal OSHA last week aligned their emergency temporary standards with the face covering guidance from both CDC and CDPH. This change allows fully vaccinated individuals to go without face coverings indoors. The Cal OSHA ETS, however, does require that organizations track vaccine status of their employees who wish to go without face coverings. Additionally, there are sectors where face coverings are still required regardless of vaccination status, which are on public transit, indoor K through 12, childcare and other youth settings, healthcare settings, state and local correctional facilities and detention centers, and homeless shelters, emergency shelters, and cooling centers. Also, yesterday, the California Department of Public Health released new toolkits and handouts for California's reopening page, and they include what does Beyond the Blueprint mean, masking handouts, travel toolkit, protect yourself and your family handouts, and all of these are available on CDPH's website as well as our website under the COVID-19 guidance page. On the vaccine front, last week, Public Health administered 285 vaccines, which seems to be our weekly average now, around the 270, 280 mark. We continue to have plenty of available appointments in all of our clinics. We have the capacity to provide 700 doses a day. We, Public Health, continue to work with organizations that request on-site vaccine clinics, and we need a week or two's notice so that we can get staff and arrangements made. Also do want to share that at these clinics, turnout is on average only about 25% of the scheduled appointments. So we will continue to evaluate the longevity of these services moving forward, but it is a good service to have, and we will continue to offer it. So far, Kings County providers have administered 82,257 vaccines. Also on May 14th, we started vaccinating the 12 to 15 population, and so far Kings County providers have administered 2,212 vaccines to this age group. Finally, last Friday, the state announced a new digital COVID vaccine record for those who wish to use this option for vaccine verification. Those who do wish to use this option can visit myvaccinatedrecord.cdph.ca.gov. We also have this link on our website. Once there, individuals enter their name, birth date, email, phone number, and a 4-digit PIN. Then they'll be sent a digital verification of the vaccine record. That is the same information that is on the CDC card that you already have. You'll also have a QR code that can be scanned if you need to prove vaccination status at any venue or business. And this is not an app, it's just a QR code so that you can pull up this information as needed. Another option, which is an option that I've used, is I've taken a photo of my vaccine card using my phone. That way I always have it available for anybody that may need to see it. This concludes my report, and I'm happy to answer any questions.
All right, thank you, Mr. Hill. Are there questions, comments for Mr. Hill? Okay, seeing none. Thanks, sir. Appreciate it. And that has ended the kind of the regular items of the day, and now we'll move to item 6, which is the much awaited study session of the American Rescue Plan funding. And with that, Ms. Kyria Martinez, would you like to lead us off?
Yes, good morning, board members. Kyria Martinez, Assistant County Administrative Officer. So on March 11, 2021, the American Rescue Plan Act, also known as ARPA, was signed into law by the president. The bill includes $65.1 billion in direct flexible aid to every county in America. The funds are intended to provide support to state and local governments in responding to the impact of COVID-19 and their efforts to contain COVID-19 on their communities, residents, and businesses. These funds build and expand on support provided to governments over the last year. We convene an Arpa Committee with the responsibility to review the rules and develop recommendations for a study session planned today to come up with some recommendations for your board. The members of the Arpa Committee include Human Services Agency, Job Training Office, Economic Development, Finance, Information Technology Department, Behavioral Health Department, Sheriff, Public Works, Human Resources, and Community Development Agency. ARPA funds allocated $29,706,802 directly from the federal government to Kings County and does not have a pass-through through the state. As opposed to CARES, the CARES funding had to go through the state. This is a direct allocation from the federal government. Cities with population of 50,000 or more will also receive a direct allocation from the U.S. Treasury. Hanford will be receiving approximately $13,077,740. Corcoran will receive approximately $5.3 million. Cities with population below 50,000 will also receive an allocation, but their allocation will come through the state. Avenel is estimated to receive about $3.2 million, and Lemoore $6.3 million. We did also screen the Office of Education to see how many funds they had received, and the Office of Education is receiving $3 million for their agency. 13 independent school districts also received funding. The largest district got $38.7 million, and the smallest received $1.2 million. Half of the money has been received, and we can get the second half either 12 months from now or 12 months after we have spent the money. So we've already received approximately $14.8 million. We created a new budget unit. As of today, the funds will sit in a fund in order for it not to fall into general fund balance. So the Department of Finance will transfer the revenues to a new budget unit that was created as requested. So the U.S. Department of Treasury published some guidance that governs the implementation of the ARPA funds. While the interim final rules become effective immediately, the department will continue to accept comments on all aspects of the proposals until July 16th. Local relief funds are described in 4 primary categories, which are as followed. Respond to the public health emergency and address its negative economic effects. Provide premium pay for essential workers. Replace lost public sector revenue, and invest in water, sewer, and broadband infrastructure. I will go into detail on the next 4 categories in my next 4 slides. So category 1, the respond to public health emergency and address its negative economic effects. This category is the largest category and has the most flexibility. In order to assess what's eligible, one should consider whether and how the funds would respond to COVID-19. Eligible uses under this section bill and expand on permissible expenditures while recognizing the difference between ARPA and CARES Act. Recognizing that the response to COVID-19 has changed and will continue to change over time. A few example eligible uses: COVID-19 mitigation and prevention, responses and adaptation costs, including capital investments in public facilities to meet pandemic operational needs, such as physical improvements to public health buildings to implement COVID-19 mitigation tactics, medical expenses, behavioral health care, public health and safety staff, payroll covered benefits, if the employee is primarily dedicated to responding to COVID-19 public health emergency. Improved design and execution of health and public health programs, for example, targeted outreach, improvement to data or technology infrastructure. Eligible uses to address disparities in public health outcomes, facilitate access to resources that improve the health outcomes, including services that connect residents with healthcare resources. Assistance to households, small businesses and nonprofits in either forms of loans or grants. Aid to impacted industries, tourism and travel. Building stronger communities through infrastructure, through investments in housing and neighborhoods. Addressing educational disparities. Promoting healthy childhood environments. A general infrastructure project would not be included unless a project responded to the specific pandemic public health need. Example, a delivery of vaccines or a specific negative economic impact. ARPA includes infrastructure if it is necessary and in water, sewer, or broadband. Category number 2 is provide premium pay for essential workers. Funds may be used to provide premium pay to eligible workers performing essential work during the pandemic. These are workers who have been and continue to be relied on to maintain continuity of operations of essential critical infrastructure sectors, including those who are critical to protecting the health and well-being of their communities. The sectors highlighted in the rules are healthcare, public health, safety, childcare, education, sanitation, transportation, and food production and services. ARPA recognizes defining premium pay to an amount up to $13 an hour in addition to the current wages, but not to exceed $25,000 per eligible worker. The rule clearly states that those who worked from a residence are excluded, so teleworking. If premium pay would increase the total pay above 150% of the residing state average annual wage for all occupations, or the residing county average annual wage, whichever is higher, we would need to provide a written justification on how the premium pay of a grant is responsive to the workers. So I did look up the average state annual wage, and it's at $65,000, and the Hanford Corcoran area is at $53,000. So the annual wage we would have to go by would be the $65,000. The rule clearly states that premium pay may be provided retroactively for work performed at any time since the start of COVID-19 public health emergency. But it also indicates to prioritize compensation of those lower income eligible workers that perform essential work. The third category is replace lost public sector revenue. So budget shortfalls are particularly problematic in the current environment as the state and local governments work to mitigate and contain COVID-19. So that is why the last category defined in the rules is replace lost public sector revenue. We recently finished our longest growth pattern from August 2009 to February 2020, and then we were hit with another recession where the economy just stayed still due to the lockdown. It remains to be seen what and how the future holds. We are seeing growth, but we haven't really defined how the recession will look. The interim rule implements these rules by stating that general revenue for the purpose of calculating a loss in revenue, and they also provide a methodology for calculating revenue loss due to COVID-19. The rule defines general revenue to include revenues collected by a recipient and generated from an underlying economy that would capture a range of different types of tax revenues, as well as other types of revenues that are available to support government services. We have put a request out to all departments in the county to calculate their revenue loss based on their assumptions, and also there is a new calculator that came out from the Government Finance Officers Association, created and is approved by the U.S. Treasury to help agencies. Our Department of Finance is also looking at the broader, larger revenues that the county has received. Although these are one-time revenues, this will help the county set up long-term financial security by leveling revenues loss and maintaining service levels. The last category, category 4, is invest in water, sewer, broadband, and infrastructure. Funds for the provision of government services include, but are not limited to, maintenance or pay-as-you-go funded building of infrastructure, including roads, modernization of cybersecurity, including hardware, software, and protection of critical infrastructure. Also allowed is to make necessary investments in water and sewer infrastructure by permitting funds to be used for water and sewer needs. Also provide eligible investments in all broadband that are designed to provide services, meeting adequate speeds, and are provided to underserved households and businesses. The next 2 slides are project proposals received from the Arpa Committee as well as other agencies. We did reach out to the Kings Commission on Aging. We also worked through the Community Service District Association to kind of get a sense of some needs throughout Kings County. Revenue loss was one of the proposals, replace lost revenue due to the pandemic with the goal of mitigating the workforce reduction in critical county public safety services, offset revenue losses in the general fund. Despite the infusion of these funds, the county will still face some significant financial challenges over the future fiscal year. However, this amount is to be determined, but the committee does feel that this area is critical for the county to invest funds in. We left the category empty to be determined because we are still trying to reach out to our departments and see what that true revenue loss is. Next, we have the public health emergency preparedness. So the Department of Public Health is projecting and continued costs for contracted medical staff used for COVID-19 mitigation and response, and it will reach $2.2 million this coming up fiscal year. Receiving $2.2 million in ARPA funds, the Public Health Department would greatly reduce its reliance on the county general fund recommended for 21-22. Also, in response to COVID-19 and other emergency infectious disease, both the feds and state are stressing the need to increase public health laboratory capacity, and the expansion of a laboratory is proposed. The ARPA funds would facilitate the physical expansion of the public health lab necessary to bring this capability to Kings County. So that is $1 million requested from the ARPA funds. Businesses and the unincorporated, we worked with Lance Lippincott, and this estimated about $500,000, $500,000. These funds would be used to and for support of businesses, retention, specifically those businesses that were required to shut down to the executive orders. The specified funds would help address some of those issues. Next, we have the Navigation Center shelter. There currently is no barrier, non-concrete shelter that exists in Kings County. Project Room Key that provides shelter for COVID positive. Currently, most similar to low barrier shelter. Navigation Center that the county has is due to end in September of this year. Approximately 1,000 individuals have entered into the HMIS and are receiving some kind of homeless assistance. So point in time, there's 305 homeless. So some of the funds from the ARPA funds are requested for the Navigation Center. As I mentioned earlier, we did work with the Community Service Districts Association and 5 districts that responded to a survey we put out. The biggest impacts in the county remain for water service providers. Out of the 5 that responded, the estimated total of 237,000 ARPA eligible expenditures. Around 211,000 of that are for water in the rears. None of the 5 districts report to having any infrastructure need, which keeps the total estimated need at bay. We reached out to Kings Commission on Aging, and due to the pandemic, the adult daycare has closed and they are in need of supplies to reopen and keep the center sanitized. They're also in need of a refrigerated truck to deliver meals. Once COVID hit, they all had to go to Wheels on Meals, and so they're also short on meal monies. Previously, they were providing 7 meals to residents. Now they can only afford to provide 5. The next category is the county emergency preparedness. So this category specifically for the county uses of the funds. This includes some board upgrades that directly offsets costs into the general fund. We also looked at sheriff PPE and supplies and the probation department PPE supplies. They do have to provide a lot of masks to the inmates there. And so their cost has risen significantly. We also included public work supplies there, and which directly again is an offset to general fund. This number is still being worked on, but this is a prelim estimate. Next, we have the broadband study. So this study would look at the county as a whole and identify areas where broadband is needed. Another category identified was parks revenue loss and parks fees waived. Another proposal also was a child daycare center. This idea was circulated and established by would establish an employee child daycare center. When a COVID hit, a lot of places closed and some did not reopen. So many employees lost their child care. We also included premium pay. So this is the area for incentive to those who continue to work during the pandemic. This area does not have an amount. However, it's also an option for some of the ARPA funds. For first five, COVID had dealt a huge blow to child development. So there is some funds to help first five, especially in helping children reach their development milestones and ensure they have access to early intervention support. Also, they would like some funds for home visitation to ease family isolation. Funds would be used to provide services to families not meeting current funded program criteria. And last but not least, we had a request from behavioral health to have an on-site therapist for employees. Again, these categories do not have any funds associated to them, but they are an option that the Arpa Committee did come up with. So for my final points, the interim rules do have some restrictions on the uses, and those are we can't deposit funds into pension funds and we cannot offset reduction in net tax revenue. The U.S. Treasury will continue to take comments. Again, as I mentioned, the rules don't become final until July 16th. Other counties have designated their spending plans. Some counties are having multiple discussions in funding series. And because also we are a county less than 200,000 population, we do not need to submit a formal spending plan to the federal government. However, all counties are required to submit one interim report, which includes the county expenditures. And the interim report will cover from the dates from July 31st on. Interim reports are due August 31st, 2021. Some suggestions today is direct staff, the ARPA committee, to create a spending plan finalized by the Board of Supervisors, or continue ARPA study sessions to discuss further projects. I also like to add that some concluding remarks. We have 3 years to spend the funds, so we don't also want to rush on making the decisions today. We are still waiting on the state budget to see how that will allocate some funds, which essentially will free up some of our ARPA funds. And also, we're still waiting to see how the federal funding will work as well. So these projects are prelim, but we just kind of want to have the discussion with the Board of Supervisors. We do believe this is a thoughtful process, and they can provide a substantial infusion of resources to help turn the tide on the pandemic. And I think at this time, Sheriff Robinson was going to add some comments. Thank you.
Thank you, Carrie. Appreciate that. Good morning, Mr. Chairman, members of the board. Dave Robinson, Kings County Sheriff. It feels good to be back in chambers with no mask on. I'll be the first to admit that. I was, when you go through the election of sheriff, you don't know that you're also going to be elected to be the spokesperson of a group like this. And so they elected me to be the spokesperson, but Carrie did such a great job. I'm going to try not to repeat anything that she did. I'm going to take everybody back, to when the pandemic started. And one of the very first things that came before your Board of Supervisors was pay cuts to employees. And that's how we were going to kick off the pandemic, because we didn't know what was going to happen. And it was like, okay, well, we've got to tighten our belts and save some money for the county to see how we're going to get through this pandemic. Now, luckily, your board stayed off of that and decided to hold hold fast and see how this plays out. And we didn't have to take pay cuts to employees. In this budget year, your board adopted a preliminary budget that actually includes a reserve for at least the first time in my 27 years. I know there was the rainy day fund, but you actually adopted a budget that has a reserve. And so one of the things that we discussed in the committee was trying to put things together for your board of supervisors that frees up funds for the future. And so you see some of the lists, they have to be determined, like the revenue loss recovery funds and those things. And what we're trying to do is set something up for your board of supervisors. So that way, you know, when you're going through your budget meetings each year and you have things that you want to accomplish in your own districts or as a whole for the entire county, you actually have money to do that. And that when we go through a pandemic again or another emergency, the first reaction isn't going to be to come before the board of supervisors and try to look at pay cuts as the very first thing. Because let's face it, over the course of time, when you look at Kings County's budget, it's a lean and mean budget. But now that you're going down the path of setting up a reserve, hopefully that's going to offer you some flexibility. Let's face it, none of us have ever seen this in our time. I've never seen where the federal government's going to send Kings County $29 million with some flexibility, right? Most of the time there's zero flexibility in this. There is some flexibility, but the common theme that we saw in the committee was health, 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 health. And so we definitely want to make that a priority, because one thing that we've seen with Ed Hill and his staff over this last year is they have been taxed, and there have been plenty of people that have also stepped in to help him and to help get through this pandemic. And you know, the light at the end of the tunnel is we're here now. We're moving forward. You know, people are traveling again. People are, you know, coming out with masks again. We're moving forward. But the health department is really the focus of kind of where these funds come from and should be delivered to get us prepared for the next go round. Now, we don't know what that will be or when it will be. But there's other flexibilities as well. But as Kyria mentioned, in one of the areas, just by using some of the ARPA funds for the health department, that frees up a couple $1 million in the general fund right off the top. Well, what that does is then it gives you flexibility to do something else with those general fund monies. And so that's kind of been one of our biggest goals, is to try to make sure that we don't, one, duplicate funds that are going to come from a state or federal budget here this year to deal with, you know, other issues, homelessness, et cetera. All of us agreed we definitely don't want to tie the ARPA funds to something that's going to be receiving funds from another source. And we want to prioritize the health department. So we definitely think the health department has to remain that priority. You also had a lot of employees that worked through this pandemic that were here. They volunteered at the health department. You know, they had to go out in public. And so we didn't put a dollar amount to the premium pay because we want your feedback. Other counties have done premium pay bonuses. Other counties have not. Some are looking at in the light of, okay, if funds are freed up, let's not do a one time. Let's look at a long term. What can we do long term for employees? And so we leave that open to your board to kind of give us direction on what you would like to see there. And so that way we can come back and hopefully have something more solid for you in the future. To the departments that are listening, some of us went out and right away tried to really hone in what our revenue losses were. Some departments haven't had that opportunity yet to really hone in what their revenue losses were due to this pandemic. And so, you know, as Kyria stated at the end, we do have a little bit of time, and we would like, you know, more time to kind of hone that in, but give departments a deadline to say, hey, you know, by this date, we really need to know what your revenue losses were, because I think Kyria has the number on it. Merced County, 70% is going towards revenue loss. Okay, well, if they're taking 70% of that and putting it back towards revenue loss, whether it be general fund or other funds, that's a big chunk of money that's going to come back to the county and the board of supervisors to then hopefully do some other things with. And so I think that's a big number that we need some more time to work with the Department of Finance to figure out what the revenue loss really is. There's a lot of rural communities that we can help, but you know, we've got to be careful in how we go about doing that. And we didn't want to just start throwing out suggestions of, here, we need to do this in Kettleman City, we need to do this in, you know, Stratford or Hardwick. But one thing that we all did agree on that Kyria mentioned in the slideshow was the water districts and broadband. And we did feel that if there's a way that we can help those communities down the road, whether it be some types of subsidy or whatever towards their water bill or towards their broadband bill, so that way they can get, those services that they need in the future, we think that would be a big boost to them. Obviously, a lot of the employees are super interested in the premium pay, but we're really cautious to just automatically say, yeah, go ahead and give, staff that work through the pandemic premium pay, because we don't want to set up something where it's like they get a one-time chunk, but we had an opportunity to do something that might have worked longer term. And so, I think we would prefer, if your board is okay with it, to come back to say, hey, here's the money that's been freed up. That gives you flexibility to do something else with it versus premium pay. But we also don't want to just take premium pay directly off the table. And it could be some type of hybrid model where you say, hey, those employees that did have to work through the pandemic and didn't get to telework because they couldn't, maybe we do something for them immediately in a hybrid, but then overall, you do something overall through the revenue loss that's been returned for all employees going forward. And so we throw some of those ideas out there because we want to make sure that your board understands we're not here hard and fast to say, hey, do this and this, but we are here to say, the health department took the lead on this, and we definitely think that they should be prioritized. But then the funding is made very clear that it should also be designated to help, these lower income and impoverished communities. And so we want to make sure we do that. And we think one of the biggest ways that we can do that is by looking into the broadband issue and looking into the community services district and their water issues, and if there's any improvements that can be made there. So, as a committee, we're here to work with all of you and take the direction that you give us today, each and every one of you. And then, hopefully we can come back and give you something more solid. But with that said, you guys control this. And if you have something more specific that you want us to do today, let us know, and we'll definitely roll with that as well. So any questions or anything, I'll be here, and thank you very much, and good job, Carrie. Thank you.
Are you complete with your presentation?
I apologize. When I mentioned the health department as a priority, they're working out of a building that was built in the 1950s. And honestly, our committee talked about this, and even though Ed Hill didn't bring it up, when we go through a pandemic again, we had to use our day reporting center as part of our, vaccination and testing center, right? Well, it wasn't meant for that because the health department doesn't have the infrastructure that they need. So we really appreciate if your board would really strongly consider that infrastructure need of the health department that's been in the building since the 1950s. The master plan for the county was to move the health department into the 2-story building here, which would give them access to a larger scale room, which would also give them access to probably drive-through services, et cetera. And so, we really wanted you also to, strongly consider that a large chunk of this money could potentially be used for a capital improvement infrastructure project to get the health department into a new building. So thank you.
Before you leave, maybe hang out there for a second.
Yeah, my presentation is concluded.
Okay, thank you, Carrie, and Sheriff, thank you. We'll move to questions, I think, from the board at this time, and I do have a couple with respect to the committee, and one is one-time money versus ongoing, and how in depth did the committee go into looking at those specific issues?
So we didn't spend a lot of time looking at one-time versus ongoing. We spent more time trying to calculate the revenue loss and trying to get to that, but we just weren't quite able to get there yet. Because originally there was a number thrown out that we thought it might be about 14 million, but it sounds like Jim thinks that might be a little bit lower now. And so we're trying to kind of figure out what that is. So we didn't really go down the path of throwing out numbers of like, hey, oh, here's a one-time idea. Because we kind of wanted to see what the revenue loss number was first, so we kind of knew what we were working with. Because we do think that revenue loss should really be high on the scale, because that goes across all departments that were impacted by this pandemic. And so we were trying to get to that number first before we really went down that path.
No, I appreciate that, and that just kind of thinking about the process, and this whole year and a half that we've been through. It's really looking at how do we create, and ensure stability at the county level for, which directly goes into each department at the county. And so I appreciate, that focus. With respect to, talking about premium pay and going into, I know, administration has laid out, a rather difficult process in trying to determine that. Could you maybe define, maybe the both of you, how you envision something to that effect? Because it's almost like an individual review of each employee that took place in or took part in this process, and maybe not.
That is, Chairman, something that we discussed, because it will be really difficult to identify certain classifications, because the Sheriff Department has, certain classifications that also exist in Human Services Agency, and Human Services Agency was teleworking as opposed to sheriff. So it is a discussion that we just really need kind of a clear direction, really think it out, because it is going to impact various classifications and different departments that did work on site versus telework.
And some teleworked for a time, but not the whole time.
Correct.
And so it's one of those that would probably take some doing to figure out. Some departments are pretty easy, health department, sheriff's office, fire department, DA's office. There's certain departments that, they didn't really have any teleworking employees, but then others, it was a mixed use. They might have teleworked for a month, but then they came back and vice versa. So that one would take a lot of time to calculate. Not that it can't be done. We would just have to work through each individual employee to figure out who actually, fits the criteria and doesn't.
There was a survey that was placed through the Human Resources Association, and 17 counties responded. And out of the 17 counties, 12 said no, they were not going to use their premium pay, 5 maybe, and 0 so far have said they would use their ARPA funds for premium pay.
So in just kind of thinking about that process, I mean, where would you see that beginning? I mean, would that be, because obviously it's going to put a burden on a department or multiple departments in trying to define that. And we run, as the sheriff outlined, a pretty lean, machine here at the county, and burdening someone with that kind of research could be significant. How you've or
we just envision seeing how other counties are allocating those funds. It is a very large task, just given the rules. However, there is an option to do it. Some just gave a lump sum to everyone, and they just gave a lump sum incentive to everyone. And so because they are public sector employees, they just defined everyone as, giving them a lump sum. So there's various options. We haven't really explored it just because we're still waiting for the interim final rules, but it is going to be a large task to see the different classifications that qualify.
I'll just add too that the committee all agreed that the employees need to be, for lack of a better term, rewarded, compensated, et cetera, for everything they've done to get us through this last year. That's a common theme. But there's also employees that did telework, but they still worked and they still got stuff done. And so we don't want to obviously discredit or discount the things that they did as well. And so there's a challenge there. And for the employees that are listening in, it's great to automatically think, and you hear of other counties going, oh, well, we gave them a one-time, $1,000 bonus. Okay, well, that's great, but that's a one-time $1,000 bonus. And our committee was more thinking along lines of if we're able to show the revenue loss and free up expenditures that can now be used for ARPA that free up general fund monies, and your board adopted a preliminary budget that includes now a fund that if we get into this before, it doesn't have to come off the employees' backs, that perhaps your board would want the opportunity to maybe look at something more long-term versus short-term. And so that's kind of why we left it open-ended there and didn't come back with a suggestion of, hey, let's get everybody a one-time bonus right now. Could it be done pretty quickly and easily without having to do a big calculation? Sure. Because you could definitely go down the path of taking a look at each department and we know which ones had teleworkers and which ones didn't. Then you would have to really hone into the departments that had teleworkers and didn't and go individually. But for some of us, it would be just the entire department. And so those would be pretty easy to chop right off the block. But once again, if we can really show this board that, hey, there's revenues that's going to be coming back to the general fund that creates more of a cushion for your overall consideration as we get through the final state budget and through our final budget, and then into obviously the federal budget. Your board might want to consider doing something totally different and think kind of outside the box in more of some of those long-term issues that you've all seen over the course of your time here.
Mr. Chair, if I could add a clarification regarding the interim temporary regulations. Nowhere in the regulations did they distinguish between essential workers who teleworked and essential workers who showed up for work. Consequently, that would be a board policy decision, but I didn't want you to think from the presentation that teleworking is in any way referenced or considered in the regulations.
Yeah, and that's a great point. Thank you, Lee.
I think that we start with the revenue loss from each department. It'll lead us down the right path to understand where we can help the individuals that worked over and above. I think revenue loss is a good start. Also, into the budget, into the year is going to be in like a week, right? So how much time should we give the department head to come up with a revenue loss program? 3 months?
Personally, Carrie can probably answer that one better. I'll just let her answer that.
So a final budget is scheduled, the hearing's August 17th. So if we have maybe a month to give them to kind of really dig into it.
17. So
No, before,
before.
like from now, for a month from now.
Okay, all right.
Mhm.
That's not too much to ask.
No, because some departments have already started it, and, some departments were really creative and, took that calculator that was given by the US Treasury, and they kind of created their own template. And so I think if we gave that template to everyone and, they could plug in some numbers and really come up with some good numbers, estimates.
Thank you.
Very good. I'd like to maybe just touch on the water and broadband comments with respect to that. And, obviously broadband is a challenge in our community and especially in the outlying communities. I know our education department, run by Todd Barlow over there. I mean, they have a great system in place. And I'm just wondering, as we move forward in this process, that maybe we work cohesively with them to see how we can build off of their system. I mean, as opposed to enhancing, private business, looking at how do we, make things work for the community. And I mean, clearly our kids have been challenged like no other generation has with respect to trying to, complete their education and move forward and not backwards in this process. And so I think, from the standpoint of this broadband question, they've had a model in place that they use that could possibly cooperatively be built upon. And so I think those are good comments and a good place to maybe try and work collaboratively as well with that. But those are the questions I think that I have at this point. Other members of the board.
On a broadband, so that would be just for the county or countywide?
Well, I mean, the focus I think is pretty open at this point. And, I mean, there are states across this nation that are talking about, some states don't have service available in their state, and they're depending on other states. And they're actually providing funds to other states to enhance their system so that it rolls across the state, and the whole question of how do you spend money, across state lines possibly, and is it compliant with the Arpa direction and things of that nature. So I think it's a really wide open concept at this time. And I think it's one that clearly this administration has supported, and continues to talk about supporting. And I think, not only this funding, but maybe further funding in an infrastructure bill that may or may not come about will be available as well. But
So my deal is on a broadband. So for people to telework from home, people live in a rural community, they pay. I know for myself, I pay like $375 a month just to have access to broadband so I can telework. And it's pretty meager at that. So would a person like that be reimbursed for his efforts to do work from home? Or would it be more of a blanket area for infrastructure?
We could research however you like to see. I think, each obviously jurisdiction also receive funding and they have the same, categories that we have. And so I think on the broadband front, it might behoove us to work with the cities and, Todd Barlow and Kingsnet to kind of get a good picture of what that would need. And then, as I mentioned in my comments, and then for those, higher poverty communities, if we can provide some type of subsidy to get them by, because like you just mentioned, it can be very expensive. You might be able to get a pretty good system right now in a rural community, but it's $400 a month. Well, most people can't afford that. And so if we can address the broadband issue where we know that it's absolutely available, and then address the lower income community issue of making sure that we can subsidize it somehow to make sure people have access to it. And so I think we can look at as a twofold, but my suggestion would be that we connect with the cities on that, because that's a countywide issue that impacts all of us.
Yeah, I think it's also with respect to, it's line of sight repeaters in most cases right now. And, I mean, I struggle with it all the time at my house out in a rural community where, if the wind's blowing, tree limbs and other things, and it's a real challenge. I mean, you just, it's not a 100% system. And so maybe that, we find that there's a necessity for repeaters and who knows, but I think it's worthwhile to, I mean, we've learned that this is one way to continue in some feasible manner through a pandemic to communicate as well. And so, I think worthwhile to really spend some time on.
Yeah, I think there's one real cellular in there too. I mean, I know for myself, I'm in a dead spot. And for emergency purposes, sometimes I know I've had issues with the sheriff's department, and when I call in a dispatch and they can't hear me, I can't, hold my arm up or leg up enough for my tinfoil to get a good signal. And then you got someone trying to break into your house. Maybe that's too long with broadband.
Mr. Chair, also the hotspots, because hotspots, work on the cellular system, but then also if you could have an interface with some of the broadband, because that'll kind of help out, and especially in the rural areas, but even the big Clovis school districts, that was one of their biggest assets, and they issued almost 10,000 hotspots to students, because it's not just the broadband capacity of the system, but it's just the number of users you might have in a household. If you have 2 or 3 students all trying to do the homework at the same time, that puts a big demand on the system.
Yeah, that's a great point.
So if you could go some kind of a hotspot, some kind of a technology, the libraries already have it, but unfortunately, like Stratford and Armona don't have a McDonald's or a Starbucks or anything that you can go down and just click onto to either upload your homework or download your syllabus. And if we had the ability to have these hotspots in some of those rural areas, so that student might be able to just park in the parking lot at the library, park in the parking lot at the school, and be able to access that technology at that kind of, and then the other is just to have the training to be able to do that. Work with a COS, work with West Hills, and have a community education class that might be a 3-hour class on a Saturday morning or something, that you learn how to access a hotspot technology, or you learn how to access the system. Not everybody has to stay on there to watch a movie. If you have enough, if you have enough memory to be able to download that, you can do your work, download it, do your work, and then upload it back on. You don't have to stay online the whole time.
Yeah, that's
I
a great.
could add to that, Sheriff. I know back in 1997, 98, on Pioneer School Board, we first charter school district in the state of California, and we were trying to bring the parents back into the children's lives and get their education. We offered them a program, how to use the internet. And we offered them, we give them credit for 1 hour for in-service for the school, or voluntary service for the school, if they learn how to use the internet through our program. Maybe with Todd Barlow, another way to draw the parents back into the children's education, and also teach them how to work technology as well.
Yeah, that's a great point. And like we don't want to duplicate. And so I think if we work with Todd, on that,
And
especially
and the other thing is
speed piece.
security, is that, it's one thing to use it. The other thing is to understand the security, all of the security measures, because that's where a lot of your identity thefts are happening and a lot of information. So part of that class needs to include a security slash, what information do you put on the web? Because once you put it on there, everybody has access to your entire life. And so, it continues to change and evolve. But part of that class needs to be responsible ownership of that as well.
Get all that?
I'm taking notes.
The other thing, and I don't know if it'd work in the sheriff's department. I'm not really sure how well it's worked, but there are the UV lights to be able to disinfect things. And when you bring people in, sometimes you take items from them and stuff like that. And have any sheriff's departments or any correctional facilities use the UV lights to?
We use it in our morgue facility. In the jail facility, we are using all the disinfectant stuff that we've ordered, which many departments have had. And then, like your board recently approved the purchase of new washers and dryers. We've obviously been washing a lot more clothes that weren't just clothes that we own. People that come in, we've been washing their clothes as well. So yeah, we're doing some of those things, but it's a great point to make sure
A
that,
bit more concerned about the electronic devices, cell phones, Fitbits,
Mhm.
Other devices that people have. I don't know if anybody has iPads anymore, but iPads and
right.
some of the music devices. So I'm kind of wondering if we shouldn't have some kind of a UV type disinfectant that doesn't involve liquid, doesn't involve, so because a lot of those cleansers have liquid to them, and
Right.
liquid and electronics don't work very well.
Yeah, for those offices that probably have more public,
Comment. Yeah.
Yeah.
Okay.
because I know like IT department takes in our computers, probably wouldn't be a bad idea for something like them as well. Okay.
Yeah, so some kind of a UV type, operation to be able to do electronics and other stuff, because I don't know if we want to even do somebody's wallet or somebody's purse.
Sure.
So some of that. And then, I don't know, do you take payments or anything? I haven't done all of the research on it yet, but an ATM type machine where a person can, and finance and the assessor's office and elections, we have the drop boxes there, but they do not have timestamps. They don't have the video. They don't have any of the things. And I was just wondering, to your knowledge, are there any ATM type machines that you can walk up to and make your tax payment or
Right.
make your payment of any kind?
I'm not aware, but that's a great point because I know that one of the issues that came up during this pandemic was just that, with people bringing things in, but they needed that documentation that it showed you dropped it off on this date and time. So, if there's a
Yeah.
way that we can move some of these things to more an electronic format that, for all departments that have public reception,
Yeah.
that might be a good.
And
good
I
way
don't
to-
know if you have to have a PIN or what, but I can just envision an ATM machine with some kind of a digital recorder that you have the date and time stamp to it. And I don't know how that industry works, but currently you go in, you put your PIN, you either make your deposit or you make your withdrawal, and everything's recorded. And I would like to do that maybe without the PIN part of it.
Sure.
But even with a PIN, it may not be a bad idea to be able to get on your electronic device and get a PIN number,
Mhm.
to drop off your tax, because I think we've had that issue come up a couple of different times. I made my payment, but it was, 12 hours too late.
Works both ways.
Correct.
The county protects the individual as well.
Correct. And so, but if you had a digital recording of when that deposit was made and that person gets a receipt
Yeah.
back.
Yeah, and it might even be something that we could work through IT with on, the courts obviously have a Dropbox that they use, and even security cameras that record for a certain amount of time, where we could go back if somebody says, no, I dropped it off at this date and time, where you could specifically go back to a date and time to say, yeah, we see that you were here and dropped it off. So,
Yeah, and I don't know if it's like a scanner type or just another, maybe two cameras. One that you can just put the envelope, in front of, or whatever paperwork has in it that you can actually scan in, but without a scanner, you know, there's some kind of photo log. And then the whole digital recording of when that transaction took place. That way, and kind of cut down on the office traffic, cut down on some of the interaction, but it also would kind of cover the individual.
Yeah, and I know that our IT director, one of the things that he brought up to our committee and then also just brought up to department heads in general recently was electronic signatures and expanding that throughout the county because, you know, we all do so much that's still unfortunately in the paper format where we want somebody's wet signature. But most documents these days, even when you buy a house now, you can do almost 99% of your stuff can all be done electronically now, yet we're still behind the times and we still use wet signature for a lot of things here. So.
Yeah, and scanners and printers, I'll be honest with you, you have a hard time determining whether that was a wet signature or not. Some of the quality of printers and scanning devices, because I'll tell you what, it's pretty.
Absolutely.
You know,
Yeah, thank you. Those are great points.
Yeah, and then just the whole electronic update, whether it's cell phones, laptops, iPads, you know, whatever makes staff a little bit more efficient in their job performance. I think it's very important, and whether that includes, you know, scanners or other kind of optical type devices to be able to make copies or make some kind of recording of it.
Thank you.
I know we have a couple hands raised, Ed Hill and also John Devlin. Supervisor Valley, do you want to make some comments before those, or would you like to wait till after those comments?
I'll continue to wait. I'm enjoying the discussion. Thank you, Mr. Chairman.
Okay. So John Devlin.
Good morning. Can you hear me okay?
Yes, sir.
All right. I just want to point out a couple more things. First off, that e-signature that was just mentioned, we actually bought that for the whole county, but there's some training that's involved. So we're trying to make sure that we train the departments how to use it properly. And there's some forms that we build for them. So we take their most significant forms first. We try to train them on how to do it, and then they can roll it out. But yeah, we were able to get that for the whole county at a very low cost. I think it was $3,600 a year for the entire county. And the other point back on the broadband, we have reached out to the schools, and there's also some $7 billion proposed in the state budget. So I wanted to point that out. So that could really help everybody, especially in the dead zones in the valley here. I think it's really important. And Sunny Wright McPeak is on that California Broadband Committee, and she's really pulling hard to try to get it into some of these rural areas because there's no profit motive for these ISPs to roll out to we'll just say it, but nowhere, as opposed to any place that has a high population center, and that's where the rub is. So they're really pulling hard for rural expansion. So I just wanted to mention that too.
Very good. Thank you.
Mm-hmm.
And is that it for you?
Yes. Thank you.
Okay, perfect. We'll move to Ed Hill.
Thank you, Chairman, members of the board. Ed Hill again. I just wanted to point out, again, great, amazing discussion. The expansion of the home visitation program in the current proposal uses the Parents as Teachers curriculum, which addresses Supervisor Verboon's example of bringing parents back into the mix as educators. And it also addresses one of Supervisor Nev's suggestions about training individuals in the use of available resources such as these hotspots, whether they're new or they're in existence, and the many other resources available in the county. So just wanted to make sure that your board was aware that those two items are captured in the current proposal for expansion of the home visitation program.
Good, thank you. And I guess you don't want a new building?
I'm always ready for a new building, but the price tag has to be right.
And then, Ed, while you're still there, Mr. Chair, the whole telemedicine, telepsychiatry, and I know Dr. Lewis, we have some telepsychiatry available now in the county. But what's your thoughts and ideas of just creating these telemedicine hubs, whether it's in the clinic, county health care clinic, or maybe even the libraries, that would allow these hubs to take place, so we avoid the transportation, avoid the different kinds of contact as to going to a doctor's office or psychiatrist, and just kind of expand and see if we can't help telemedicine and telepsychiatry all we can. And I at one time I thought, well, everybody has a smartphone, everybody can just do that at home, but broadband and the whole ability is not there yet, plus the security and the HIPAA and everything else. So if we could create these telepsychiatry, telemedicine type opportunities, and I don't know what the cost is to create those little office suites to be able to do that. Dr. Lewis, I think, has some experience, and but to be able to do that in each of the rural communities, so they don't have to, currently we make 5 trips a week to Fresno Children's Hospital and hit all of the veteran services and all of the specialty doctors in Fresno along the routes. And you're not going to get every appointment to a telemedicine or telepsychiatry, but if we can get 10 or 15 or 20%, that it just helps the entire system. And I think Dr. Lewis is there too.
Yeah, Supervisor Neves, thank you for bringing this up. It is part of our MHSA plan to expand telehealth into the rural communities. We are planning that. This would be a great way we can get a number for that. I would also like to just again mention the county employees. What we've learned from recent research as well as anecdotal information is that 7 out of 10 caregivers are experiencing mental health symptoms right now. So we have a real need within county employees also as our most important resource to make sure we're meeting their mental health needs so that they can go on to do their functions to meet the needs of the community. So I just wanted to mention that too. Thank you.
Thank you. Jimmer.
Hello, Jimmer, Director of Finance. I just wanted to mention about the revenue loss. We've been working on that calculation. The sheriff wasn't in our last meeting, but actually we're coming up with a revenue gain. So I wanted to make sure you don't put too much stock in the revenue loss. At this point, we're breaking down individual accounts, seeing if we find one-time monies that we can pull out, but it's kind of a complicated calculation that we have to do where we actually take a fiscal year as a base year, but we're using a calendar year as actual revenue, and they call it counterfactual revenue we're trying to calculate. And we had a couple departments that really had some increases in revenue, like HSA, because more people needed help. And those increases in revenue are impacting the calculation that we're doing. We've gotten some information from the departments, but a lot of them are talking about expenditure increases, which really isn't part of the calculation. It's based solely on revenue. So we're working through it still and hope to come up with some sort of revenue loss so we can apply some ARPA funds to it. But at this point, it's looking like it's not going to be big. It's not going to be the 12 million range that was thrown out there a while ago.
Yeah, and Mr. Chair, I think, two that come right off the top of my head are parks and grounds when the parks were shut down and the libraries. I would think those 2 departments would have some kind of a loss, even though there are additional funds from different areas, but those 2 departments, being offline for 13, 14 months, had to affect their revenue.
Right. And there's some that have that, although this calculation looks at the county in its entirety. Right. It's not breaking it down by individual departments. And so it's looking at the county as a whole is specifically what it says that we base the calculation on.
Yeah, because even like transportation in Angie's shop at CART, our revenue fare box ratio is in the tank, and the expenses pretty much stayed the same, but we've got a lot of the other funding to be able to make up the difference. And so, I can see your point to where revenue comes in a different way, but the reality is the fare box ratio, the fees collected at the gate and the book fees, reserves at the library would be 3 that would be affected, but there have been other sources of revenue to backfill some of that.
Yeah, and, you know, at the end of the day, the revenue loss may not be as significant, like Jim's saying.
Yeah.
But one of the things that I think Dr. Lewis makes a good point on, is the mental health piece of it. And let's face it, you know, there's a lot of, wiggle room in this funding. And so when you talk about parks, okay, well, if the parks have been shut down, that's a mental health piece as well, because you can't get a family outdoors to go to a park, et cetera. And so that's the nice thing about this funding, when it comes to dealing with the pandemic. There's a lot of tie back to the pandemic. And when you tie in mental health, it really opens up the door for a lot of departments and even, you know, like parks and libraries. Those are mental health breaks for people when they go to those sources. So at the end of the day, we may not be able to come back to your board and show that there was this big revenue loss, but we could probably come back and show, hey, we didn't show a revenue loss here, but you can still use the money for this piece because of the tie-in to health, mental health, wellness, et cetera. So
Yeah.
it's a great point.
And Jim, you know, while you're there too, and I mean, this is always on my mind and, you know, I think if you look at, you know, mental health, studies show that the number one impact to, mental health is one's, financial health starting there. And when we talk about, reserves, I mean, you made a very impactful statement, months ago that talked about, you know, reserves and the health of the county. And I, you know, the one that just, you know, begs for, some attention is what was it? Something on the order of, we have reserves to pay about, what, 3 months of wages? Could you
Right.
repeat that?
Yeah, it was 3 pay periods.
Yeah.
If we didn't have any income whatsoever, and that
Yeah.
probably won't happen, but it's just a good illustration of where we are. In this new budget, we're putting aside 6 million more into reserves, and I think the board should feel really good about that. You know, it improved my mental health with that recommendation, because it does give us some a cushion. And this influx of the CARES money and now the ARPA money has really kind of helped with our cash flow, where we're not going negative like we were in the general fund. Those are things that improve mental health. You know, and speaking of that, Lisa came up with a great idea on this childcare, and that I think is, you know, I remember struggling with that. That is a huge mental health drain on parents with young children. And that would be, you know, just a really good project for, because I think it could be set up and then run by itself. It wouldn't take, you know, ongoing support. And this is one-time funding that's come in. So it really should be looked at, the ARPA funds, for one-time projects to get things up and started. But
When you talk about mental health and you kick off a pandemic with a pay cut, that has a big impact on your almost 1,600 employees, on their mental health going into it. So if we take that off the table in the future, that'd be awesome.
Yeah, for sure.
Mr. Chairman, can I go ahead and join the discussion now?
Let me just check one more thing, because I think, Ed Hill had his hand raised and then he put it down. Ed, did you have one further comment?
Mr. Chairman, thank you. It was addressed by another comment, so I'm good. Thank you.
Okay, very good. All right, Supervisor Rowley.
Yeah, no, thank you. I wanted to interject at that point, and just springboard off the sheriff's last comments. I want to, obviously, from what I remember, the discussion was closed session. And so at some point it must have been reported out or it was made public, regarding the employee salary reduction. So I'm gonna go ahead and feel free to say this, that right there was a recommendation to the Board of Supervisors. And the Board of Supervisors, in my opinion, we did the right thing by not accepting that recommendation and starting off the pandemic like that. So credit to my colleagues on the Board of Supervisors. We did our job. We led. That was the beginning of the pandemic there. That was not a good idea. And I 100% agree with Sheriff's last comments there. Now, Mr. Chairman, to that point, here we are again. It's our opportunity to do our job. It's our opportunity to lead on this $29 million that's coming in here. And so I first want to thank Kara and the staff and everyone on the planning team for getting the a model, or at least the ability for the Board of Supervisors to have this first discussion here. And there are a lot of good ideas. I like the energy. I'm positive here on some of the things that I'm hearing. And so I also like the fact that, as Kara is recommending and the sheriff, that we take our time with this, because this is the first time that we're even getting to absorb a lot of this information. And then the five of us can work with staff, can work with this committee to keep coming back and build something here. So we hit a home run here. But Mr. Chairman, I have 4 points here that I want to hit on. One, we again, we are hearing a lot of good ideas, but the one thing that I haven't heard yet, and I was hoping to hear it publicly from Mr. Hill. I spoke to him yesterday, and so I do have some comfort to what I'm about to say, but there's discomfort in the fact that we have not talked about the hardest hit populations, the hardest hit part of our workforce in Kings County. And that's what these funds are for, to mitigate the negative impacts, both health and economic, that COVID hit us with. And so, I'm a little disappointed that we haven't heard anything in the presentation or anything today as it relates to the Latino community, who was the hardest hit, had the highest infection rate in the County of Kings, had the highest death rate in the County of Kings. No mention to the workforce, especially farm workers and our meat packing companies, those who the data shows were the hardest hit. And so that's where an investment of these funds should be talked about, should be going. And so, again, I take some comfort in having the calls that I made yesterday. I spent most of the day on the phone with Kira, with the sheriff, with Mr. Hill, with Dominique, to get some kind of structure, because the packet that we brought home for the weekend to read didn't, as you know, Mr. Chair, didn't have a lot in there for us as decision makers to really prepare for today. And I get it, because today's an opening discussion and that is it. It's a study session. That being said, Mr. Chairman, I would ask and hope that when they come back on the second time, whether it's next week or 2 weeks, when this item comes back, that we hear about that, we learn about that, because to me, that's very important. And I would hope that it's very important to the entire Board of Supervisors. We know that coming when this pandemic hit, and whether we were in season or we do know that the farm workers, they were in the fields and they were out there and they were picking crops. And so now as they return back, they start to return back to Kings County, and they're going to be right back out there. And as farmers, you guys know better than me that when that high time is, and when that's coming, that critical point, we need to be prepared. And if we're not prepared, then it's shame on us, because we don't have the comfort of having the ability to have excuses this time around. The first time, man, no one knew what was coming. We haven't been through this before, obviously, so mistakes were made. That's okay. It's okay, because we were learning. It's not okay if we learned and now we got this funding from the government and we didn't invest it to fix those mistakes so they don't happen, whether it's another COVID pandemic or XYZ pandemic or emergency that hits us again. And that's what, in my mind, that's what this money is for. And that should be the vision of that money being invested. And so I look forward to having that discussion coming back. We know that in Monterey County, where these farm workers started off, thousands of them every weekend, you see thousands, 4,000 a day, 3,000 a day on weekends at the Monterey County Fairgrounds. they've been vaccinating farm workers. So as that population migrates to us, maybe we can learn a little more from Mr. Hill on, how much more we are prepared by having vaccinated farm workers enter our county, and what's left in there and the work to do to protect the health and safety of not only them, but all the residents of Kings County. The second point, Mr. Chairman, is when you talk about the premium pay for the workers, I am in agreement with that, and I want to say that for feedback to you and the staff that's going to continue to work on this. I'm very in favor of making sure the people who took that extra step as a county employee to serve, that they do get something, up front. And so the one word that we didn't hear today is the labeling them of frontline workers. We hear essential, and all our workers are essential, whether they teleworked or whether they were very much on the front lines here in the pandemic. But I think it's important, and easily we could identify our frontline workers. The sheriff pointed out the obvious ones: his staff, the detention deputies, the staff that work in detentions, the firefighters, and as him and I talked about yesterday, the staff from the coroner's office, who very early on, how scary was it when we didn't know exactly what was going on? Coroner's office had to pick up the deceased, had to perform the autopsies. The staff around that coroner's office, they were very much on the front line. And I can't imagine the hits to their mental health on that, and then having to go home from that work environment and go home to their family. So I think that's something that Kira can work with department heads to very, very easily identify those departments. And then secondly, department heads to identify, they know who volunteered from their staff or who went the extra mile, whether you worked in the Department of Elections and you came out and now you're working with Mr. Hill on COVID mobile testing events, the vaccination rollout. We know that in some cases our county employees were exposed, being around hundreds of people a day, especially early on the mobile testing, and whether or not county employees were infected by COVID by performing those duties as well. So I'm all for that, Mr. Chairman. The third one that I want to talk about is, when this comes back, maybe next week, we talk about these projects that I think are fair to be questioned. Okay, so the daycare center project, there's a lot of questions just on my mind about that. The navigation center, there's a lot of questions on that. Whose district is that in? To talk about this homeless navigation center, I think we also got to look at where we're at now, Mr. Chairman, where COVID restriction rules now allow us and staff to hold these town hall meetings in these proposed areas where something like this navigation center is being proposed to be looked at. We need to hear from the surrounding communities. We can now have the opportunity to have these town hall type meetings on that. The daycare center, Mr. Chairman, I don't agree on the one-time funding being an ability to do something of this magnitude. I want to keep an open mind and listen, and so again, to bring back these projects and have an opportunity for us to absorb this information during the week and be prepared to come back and ask questions on these types of projects here. How is a daycare center going to be sustained? Mr. Chairman, am I cutting off? Because on my end, I'm seeing I don't know if I'm locking up.
You're loud and clear.
Okay, thank you, Mr. Chairman, and I'm almost done here. And so I want to note that, Mr. Chairman, to staff, that to bring this back so we can talk about more in detail, get more information during the week, and prepare to talk about some of these other projects and questions, especially projects that weren't even on our list when we went through this a couple of months ago when we were talking about earmark funding out of Congressman Valadeo's office. This is not even a project that made the list, much less made the top three. And those projects we have identified, it would be good to look at what projects that are on our previously identified list that can in some way be connected legally and ethically to these ARPA funds to get something done. Lastly, Mr. Chair, I am in agreement and in support of health department infrastructure. To me, that's a perfectly good use of the visions of these monies. Again, if we learned that our health department didn't have the infrastructure needed during the pandemic, then we use this money to make sure the next time it comes around, we solved that identified problem. So I am in agreement with that, Mr. Chair, and I'll leave it there for now. Thank you.
Very good. Thank you. All right. Further questions from the board? Seeing none. You know, I will throw out one thing. I know that infrastructure was brought up with respect to the health department. I know early on, a couple of years ago, I went down the path with our CAO and looking at, you know, the P3 opportunity for structural improvements. One of the challenges that we face is that, you know, we can't build a building and then charge back to the, you know, for the service to be located in that building. But a P3 opportunity provides that opportunity to do you know, a long-term ownership and take ownership over time, but still, you know, address the infrastructure needs of departments. And I know we have numerous plans, you know, out there. I know that the old jail is a site that's, I think, a premium location. And, you know, we kind of looked at how do we possibly, you know, build a building that would possibly house, you know, maybe public and private over time, but come back to the county as a fully owned building. So I think there's an opportunity as well there to look at that opportunity and, you know, possibly if there's some seed money that was, you know, available out of the ARPA funds, and yeah, something you can look at. But anyways, at this point, I don't see any further comments.
Mr. Chair, I just have one more, and that's just kind of a coordinated effort because the communities or the incorporated communities are also going to get funding, and just make sure that we're coordinating with them to make sure we don't have a duplication of services or a duplication of whether that's education through the Department of Ed or transportation through Angie or through the respective cities, and just make sure that we're not, you know, duplicating any kind of service. That kind of a coordinated effort, I guess, in delivering services to ensure that we do it the best and most economically way. And that means adding, you know, augmenting one project or the other. But some of the communities are also getting some incentive funds, and just make sure we don't.
Okay, I got it.
Double dipping.
Mr. Chairman?
Yes, sir.
On the, I did want to note quickly, I'm supportive of all the discussion on the broadband. And again, I guess we are blessed with a little bit of time here, and hopefully the state budget with all these placeholder monies that they have, maybe we'll have a lot of that stuff answered and have the ability to not have to use our funds, our ARPA funds. But if the state doesn't take care of it, I'm in agreement that is something that is these funds should and could be worked with on that. And then to end on that point, we mentioned the conversation mentioned several times working with Superintendent Todd Barlow, but he also has the 5 elected officials, right, on the Kings County Board of Education. So I think we need to make sure they're in the loop as well. Thank you.
Okay, well, first of all, thanks to administrative staff and to the committee for all your efforts. We truly appreciate this. And I know there were a couple of timelines that were thrown out. I don't think there's a need to come back in a week. I think these are going to be some longer term discussions that are going to have to evolve over time. And so we'll look to to administration and to the committee to come back with appropriate timelines and as deemed necessary to revisit the issue and move forward on that. But again, thank you all for your comments and look forward to how we go shopping.
Thank you.
Or not. All right. At this time, we have moved to item 7, which is board member announcements and reports. Supervisor Verboen.
Thank you very much. I think Joe now, Supervisor Ned will cover a couple of things we hit here, but I went with Afternoon Rotary, had Victor Davis Hanson come in our community last Tuesday evening, and he had a nice presentation in the packed house, talked about the COVID and all the ins and outs of conspiracy theories and what really happened to what we've had to live through. Also spent a couple hours with the Weather Channel talking about the Corcoran sinking, and did that on Tuesday as well. And that's about it. It was hot.
Very good. Supervisor, you good? Supervisor Nips.
Thank you, Mr. Chair. Yeah, a couple of items, several items, I guess. West Hills College Paramedic Advisory Committee had a meeting on the 16th. We approved an action plan to try to improve our pass-fail rates as all education struggled under these COVID operations, and especially when you're a hands-on type teaching tool and in paramedics and EMTs and nursing. So new improved learning platforms, virtual classrooms, and trying to get more student involvement and increase the pass rates. As you can imagine, a paramedic, EMT, nursing, the quicker you can get that student out of the classroom and then into that testing environment, the better off. And due to some of the delays, I think was part of some of the pass-fail ratios. But we'll continue to work through those issues, and that program continues to try to get that paramedic staff, even if they don't get the paramedic level, let's say they're EMTs, and we can move forward. Kings Federal Credit Union had a supervisors meeting over there, first one in over a year, and so it's good to be back in that. Kings Partnership for Prevention had their annual meeting at Koinonia Church and changed their names in the future. I think you can plan on Kings Partnership moving forward with the keep going, keep growing idea to address issues of Kings County in the future. Logged on to a couple of broadband strategies for local agencies. The California City News, about a 10 or 15 year old organization, continues to work on those issues. And so we continue to log on to those webinars and see what's going on around the state of California. Southport Kings had their meeting on Thursday night, adopted the budget, set the assessments for $9 an acre for the coming year. Also approved the Land IQ contract, which will help with some of the reporting. Also set the calendar and received the updates from the Sustainable Groundwater Management Act. Some of the reports are coming back from other agencies that Department of Water Resources wants to focus on quality, not just quantity. And I really had a feeling that was going to happen. It's not just quantity, it's also quality. And so we're going to have to be looking at those issues in the future. The event Supervisor Verboen and I attended, the May Move Challenge, was between child support and job training departments, resulted in over 10 million steps, 10,284,000 steps taking place in the month of May from those two departments. And if you figure 2,000 steps to the mile, that was over 5,000 miles of activity that those two departments had. 41 staff members from those two departments, the job training and child support. Job training was able to take the trophy with their staff averaging 8,465 steps a day per person. And when you do the math again, that's about 4.2 miles per day. Child support had a very impressive 7,800 steps per person per day, which is still a very respectable 3.8 miles per person. But again, Lance Lippincott and Job Training Department did an outstanding job, and certainly want to thank those two departments for getting together, because I think those kind of challenges and that kind of activity is good for not only the individual, but also good for the department and
The mental health.
the mental health. And again, and making a little challenge out of it. Yeah, they celebrated with breakfast burritos that it's probably going to take them 10 miles to walk off those calories. But, we'll have to work on the map problem, issues in the future. But very impressive of what those two departments were able to do. And certainly want to thank Lance and Maria. Several events were canceled due to the heat, which was just difficult last week. The Thursday night market, the Lemore's Rockin' the Arbor and Lemore Raceway, all events were all canceled and postponed. And some of them, we're going to come back this week with a little bit better weather. But if you look at the long-term forecast, starting Sunday, we're going to be back in the 108, 109 range. And so we'll continue to work on that. Yesterday, First Five had a special meeting and approved their meeting schedule and strategic plan update. That strategic plan is a 5-year plan currently in place for 2020 through 2025. But with the COVID, really had to do some tweaking and get that strategic plan kind of more ready in today's post-COVID environment. As Director Ed Hill talked about, the kindergarten readiness activities, and then all of the grantee contracts. We also expanded out to Kings United Way and the evaluation contract to evaluate services. So, the Kings County Homeless Committee yesterday had a discussion about the grand jury response, and that will be coming to us in a future date. We also received a letter from Overland Stockyards, and that was read into the or delivered into the record, and we're going to address that as well. And certainly want to thank staff for all of their interaction, and I think that helps a great deal when you're able to address those type issues quickly and efficiently. So thank you for that. Also, continued discussions about low barrier shelters, funding updates. They come up with all these different programs, the Front Door Project, and then the meeting schedule for next year. So that continues to be. And then also the water tank problem that was in Lemoore yesterday resulted in loss of life. And so thoughts and prayers for everyone affected by that event yesterday. And you can never take safety, you can never take safety for granted. You have to use safety every time. And it's important that every staff member goes home at the end of every shift. With that, thank you.
Thank you, Supervisor Valley.
Yeah, Mr. Chairman, I want to again congratulate Mr. Chuck Kenny on the appointment that he received today, but also our outgoing former Director of Community Development will this evening will be sworn in at the Corcoran City Council meeting today. Will be sworn in as the new city manager of the city of Corcoran, and I wish him the best of luck as well. Thank you.
Thank you. And for me, number of meetings last week, but obviously we had our monthly meeting with the San Joaquin Unified Air Pollution Control District. Because of legislation, we're looking at the phase out of ag burning. The challenges that we're faced with the loss of biomass plants throughout the state of California. And so with concurrence of the plan with CARB and a commitment of $180 million in funding to look at test projects to see how we deal with ag waste over the next, how we transition from being able to burn products to being able to dispose of them in alternate methods. The commitment was made by the state legislature, at least at this point. I know it's not an approved budget. It's a bit of a strange process this year, but at least the commitment was made for $180 million. And so with that, our board approved the ag burning reduction plan, and finally ending that over a 4-year period. And, again, that was concurrently approved by CARB. So we have a starting point and some funding to find new technologies to deal with ag waste with respect to air quality and meeting all the air quality requirements through the Clean Air Act. All right, with that, I will move to carry it for board correspondence.
Yes, Chairman. We received 4 items in board correspondence from the State Board of Equalization. 2021 Taxpayer Bill of Rights hearing is scheduled for August 24th at 10 a.m. Gottfredson Law Firm, 3 separate appeal packages regarding condition use permits for Westland Grape Solar, Westland's Chestnut Solar, and Westland's Blue Solar. We also received the Overland Stockyard letter regarding the proposed location in for the Kings County Homeless Shelter. And then Tim O'Laughlin petition for change involving a proposed 100,000 acre-foot water transfer between Oakdale and South San Joaquin IDS and San Luis Delta Mendota Water Authority. For upcoming meetings, we have no board meeting scheduled for July 6th, and we have the budget hearing scheduled for August 17th and August 18th. For upcoming agenda items, we have quite a few for June 29th. From administration, we have the COVID-19 update, a redistricting outreach plan. From the Ag Commissioners, we have an agreement for petroleum enforcement activities, an agreement with Waymaster enforcement activities. In behavioral health, we have a few agreements, one with 4 youth specialty mental health services, amendment to an agreement with West Care for substance use disorder program, also an amendment to an agreement with mental health systems, an agreement with Educational Centers Incorporated for residential treatment program services. From Community Development Agency, we have a farmland security zone contract application. And from the Public Health Department, we have some Childhood Experiences Aware Initiative, an MOU and interagency agreements between Public Health, HSA, and Probation, King's Care Essential Workforce Support Program contract amendment, an MOU with KCAO for an early Head Start programs. From HSA, we have the Project Room Key Food Service Agreement Incorporated. And from Public Works, we have an easement deed acceptance, an item on vehicle purchases, an in lieu parcel map dedication, traffic paint purchase, and also the 2021 SB1 funded KC roadway improvement project.
Very good, thank you. All right. So at this time, we will move to closed session. And today, closed session, we have numerous issues to deal with. We have starting with a significant exposure to litigation, two cases, government's code section 54956.9 D2. We also have a personnel matter, government code section 54957, public employee appointment, county administrative officer. We also have conference with labor negotiator, meet and confer, government code section 54957.6. And that kind of covers our closed session. And Madam Counsel, do you expect any reporting out?
We do not.
Good, thank you. All right, we do have an 11 o'clock in-home supportive services public authority meeting. And so at this time, we will take a short break and we'll hold for the IHSS meeting, and then we will reconvene as the Board of Supervisors and enter a closed session. So with that, thank you, and meeting adjourned. I think she's down at the bottom, maybe. There you go. Yep. Okay, this time we'll go ahead and call the meeting to order of the Kings County In-Home Supportive Services Public Authority. Would you please call the roll?
Joe Nevs,
Here.
Richard Valley,
Here.
Doug Verboon,
Here.
Craig Peterson,
Here.
Richard Fagundes.
Here.
Okay, we have 5 present, be able to conduct business. We'll move to item 2, which is unscheduled appearances. Any person may directly address the board at this time on any item on the agenda or other items of interest to the public that is within the subject matter jurisdiction of the board. 5 minutes are allowed for each item. Do you have any comment?
I do not have anyone with their hands raised and no written comments.
Okay, very good. Thank you. Now we'll move to general business, item 3, which is general business items and approval of the May 25th, 2021.
Move to presented.
They have seconds.
Okay, we have a motion and second. Please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor. Motion carries. We'll move to item B, which is staff announcements and brief reports on activities of the in-home supportive services. Sonia.
Good morning, board. We actually do not have any staff announcements or updates. And unless you have any particular questions, there's no significant changes from last time we reported when it comes to activities of the IHSS program.
Okay, very good. Thank you. We'll move to item 4, which is board member announcements. Anyone have any items they would need to bring before board? Seeing none, we will move to item 5, which is closed session, and it's conference with labor negotiator, meet and confer, government code section 54957.6. And so at this point, if there's nothing further to come for the board, we'll move to closed session. Seeing none?
I have a question. How are you handling the closed session for this? Because this is not a closed channel. So do you have a separate Webex set up for the closed session portion?
We do not.
We can probably remove folks from this, can't we?
Yes.
The only problem will be is will they be able to get back in?
They don't need to. So Monica and Jason, if you guys can leave the meeting.
Okay, we're gonna go ahead and we'll do that here. And just
Let's see,
we'll move to
And Matthew as well.
closed session, sure.
get Richard Valley back in. I don't know who in NRR.
Okay. Am I correct in presuming that it looks like there will not be any reporting out?
No, we do not have any reporting out.
Thank you.
Supervisor Raleigh. Okay,
Thank you.
so did he leave?
He probably thought there was another Webex set up. We handle ours.
Diane, how do we eliminate the YouTube?
He's doing
handling
we're
it.
doing that in.
Okay. All right.